Our second group to your left is noted by the Indiana State Department of Health. This particular project is managed by the Regenstrief Institute, a not-for-profit organization that focuses on public health informatics research, also has strong academic affiliations. They are a powerful entity in this collaboration because, with a focus on health information exchange, it's wonderful to have an organization that has more than 30 years of health information exchange experience and also happens to be an internationally renowned research center. Their primary focus is the Indianapolis metropolitan area, but as Brian may mention in his presentation, this particular health information exchange is rapidly expanding beyond that particular geographic area. And then finally, our third and final organization is a collaborative that includes the Washington State Department of Health. Other organizations that operate here are Inland Northwest Health Services, which serves as the primary health information exchange. This also happens to be a bi-state collaborative, so the Idaho State Department of Health is also involved. They became involved in the process beginning in year 2. And the other organizations are the University of Washington, which provides a research element, and we also have the Spokane Regional Health District. I should also mention that in Indiana, the Marion County Health Department is an integral partner there. So the basic idea that we established almost 2.5, maybe close to 3 years ago now, was we saw the importance of beginning a process to help us understand how health information exchanges can play a critical role with local public health at both the state and local level in defining various types of biosurveillance, beginning first with the priority of situational awareness, but also expanding to case reporting over time, and some of that activity in case reporting did begin in the second year. And developing a process, working in complete collaboration with Health and Human Services, Office of the National Coordinator, and the Nationwide Health Information Network to develop our mechanisms using appropriate standards and interoperability specifications to ensure that this kind of information can flow appropriately from the medical community with support from health information exchanges, subsequently to state and local health departments, and then finally, based upon what the state health department determines as is appropriate for information at the federal level, CDC would then subsequently receive the information as well. And in terms of a question that was asked earlier regarding NHIN Connect, let me point out that we are in the very final stages of implementing NHIN Connect at the Centers for Disease Control. And we are conducting that process in collaboration with all 3 of the public health HIE collaboratives that you see on this particular map. Within the next month, and if all goes well, within the next week, CDC will be in production with NHIN Connect, and we will be able to communicate via that mechanism, sending live data in production from at least one of our state public health HIE collaboratives. If we can move to the next slide, please. And probably the best way to approach this would be to go ahead and move everything through, and I'll just go through it step by step. If you want to go ahead and hit the next. And
yep. There you go.
I think you go to number 4. Okay, and I believe that'll do it. So this is what we refer to, or at least what I refer to, as another aspect of our contracts, which is establishing a bidirectional communication mechanism. And not all of the steps are shown in this particular slide series, but I'll go through at least a few of them in the time we have to give you an idea of what I'm talking about. But the basic notion here is, how can we interact with the health information exchanges as a representative, if you will, for the medical community to acquire the kind of data that state and local health departments desire and then subsequently send that information to the federal government, Centers for Disease Control, as was previously described. But one of the key aspects of this process, and one of the things that I present routinely, is the importance of establishing a good, sustainable business case such that the medical community will have a desire to continue to share this information with public health once all of the funding has gone by the wayside. So the bidirectional communication process is the fundamental paradigm by which we look at ways to establish that sustainable business case. That is, how do we demonstrate value to the medical community, asking them to go through the process of sending this data, appropriate data, to public health by transforming that data in some way such that they find value in it. That's really what it boils down to. But let's now go to the diagram, and we'll go through some aspects of this bidirectional. I'm sorry. There you go. Go through some aspects of this bidirectional communication process. In this particular scenario, what we're looking at is starting with the federal government, where the federal government has some information, or it has a desire to acquire information, and it sends a message to the state health department indicating that they would like this particular kind of information. The state health department will then acknowledge that they have received that request, and then subsequently they can interact with the appropriate agencies, centralizing this process primarily, at least in the way that we work things in this paradigm, through the Health Information Exchange. And then the Health Information Exchange can collate and provide that particular kind of data, send it to the State Department of Health, and then the State Department of Health can subsequently send it to CDC. Now, in this particular paradigm, one of the things that's important to understand is that the kind of information that may go to the State Health Department may be more detailed, may even be identifiable. That depends upon the relationship between the health departments at the local level and the Health Information Exchange, and then, of course, the kinds of data use agreements that are established between the Health Information Exchange and the medical community. But the important point is to note that at this level, there is the ability, if there's an agreement between the state and the HIE, of providing data that's more detailed and perhaps more identifiable than would take place at the federal level. Now, what we have currently established in this working paradigm that we are doing at this moment between the state and the federal government is that we utilize a de-identified aggregated format called GIPSI. GIPSI stands for Geocoded Interoperable Population Summary Exchange. A process took place where state and local health departments, working in collaboration with CDC personnel from various program areas of expertise, designed the content and also the technical specifications by which GIPSI data would go from the state health department to the federal government. This process was put together in a formal implementation guide, subsequently went through the appropriate NHIN committees, and is now approved as a NHIN standard for population summary exchange. At this juncture, the data in the GIPSI format for H1N1 is coming to the CDC from all three of our sites via FinMS. And as I mentioned earlier, within the next several weeks, we hope to be in full production with at least one of our state sites in receiving that data via NHIN Connect. One other thing that I'll mention to you, and then I'll turn it over to Brian. For those of you who might have the luxury or the opportunity to attend HIMSS, I would encourage you to visit the HIMSS Interoperability Showcase. In that showcase, we will show you in tremendous detail how this bidirectional communication process works, beginning with the clinic, the hospital, or the laboratory, working through the HIE to the state health department and to the federal government. And then we'll also show you in detail how that process works and going back from the federal government to get back to the medical community and we'll be exploring different things like automated case reporting and bidirectional communication mechanisms that allow information to go directly to healthcare providers. In addition, we also plan to have an international demonstration where we will talk about some important developments in Canada and showcase how information from that area can come into the United States. With that, I'll pass it over to Brian. Thank you.
Thanks, Charlie. Let's leave it on this slide, Steve, for just a second, because I want to explain kind of how things work from the Indiana perspective to kind of put this in context in a real use case, real world environment. So the way I think about what in the NHIN specifications we call the Health Information Event Messaging Specification, or HIEM. The way sort of I put this in the context is in healthcare we constantly have data that's being generated and fed from one system to another, right? So you can think about patients are constantly coming into the clinic, they're getting registered, and the ADT system is transmitting those ADT messages. So in very much a similar way, HIM would allow someone to say, hey, I'm really interested in that feed of registration messages, so let me subscribe to it. And then every time a new message is available, then the subscribers to that receive that. So it's a sort of way to really make efficient the process of interfacing to different services that are available through the NIM. So in Indiana, in the context, what we have developed, and as Charlie mentioned, we're working to move that into production in the coming weeks. Every second, Regenstrief receives a live feed from ADT systems in emergency departments around the state of Indiana. So currently we have 76 EDs that are feeding data to Regenstrief. And through our contract with the State Department of Health, we send deposits of that information every 3 hours to the state. So every 3 hours they get an update on the situation around influenza-like illness, pneumonia, all the other indicators that they're looking for. Then once a day, when this goes into production, we envision this to be once a day then, the aggregate level data that Charlie described in the GIPSY format would be sent over the NHIN from the State Department of Health to the CDC. So it sort of chains up and scales very nicely. The ability to send real-time feeds and then extract and aggregate and share that information at the most appropriate time depending on the workflow and the needs of the users. Okay, next slide. Once it arrives at CDC, I think Charlie mentioned this, there's a very strong use case and business case at state and federal levels for how they would use this information to monitor the situation, whether it be with H1N1 or some other disease that they are tracking at a state or federal level. Next slide. So the importance to us from a HIE perspective, from a state perspective, is that HIEs provide common infrastructure. I think Simon, talked a lot about scalability and the ability to sort of leverage what exists and build on top of that. We believe the NHIN provides for this and meets this goal of ours as well. Next slide. And then I want to briefly just mention some other lessons that we've learned both through our NHIN trial implementation work as well as our work with the CDC. We've said this a couple times, I won't belabor it, but the barriers often have more to do with organizations and less with the technology. There's a lot. The other way I'll put this is the good thing about standards is there's a lot of them to choose from. So if we can choose the right, if we can define the specifications that meet our needs, then we can move forward very quickly once we have the organizational, the policy, the legal aspects have been ironed out. In our instance, workflow remains king of the hill. We have found that clinicians and other users, including public health professionals, care a lot about workflow and efficiency and how this NHIN thing is going to fit into their daily routine in providing care and monitoring the population's health.